So today the topic for debate is physician-assisted death. To start off, physician-assisted death, according to MedicineNet, is a physician when a physician prescribes a lethal substance that is ingested to end one's life. The three significance claims I'll be making are that terminally ill patients should have the right to control their lives, which is autonomy, and terminally ill patients should have the right to die painlessly and in comfort, and terminally ill patients should have the right to individual liberty when it comes to physician-assisted death. There are some eligibilities for physician-assisted death, and a patient must be at least 18 years old and have at least 6 months to live. Physician-assisted death is legal in Oregon, California, Colorado, the District of Columbia, Hawaii, Vermont, and Washington. The first state to legalize physician-assisted death was in Oregon in 1997. They passed the Death with Dignity Act, and according to CNN, it allows terminally ill organs to end their lives through the voluntary self-administration of lethal medicine. The Death with Dignity Act also has some guidelines. According to deathwithdignity.org, 2 physicians must confirm the patient's residency, diagnosis, prognosis, their mental state, and two physicians must ensure that the patients are qualified for, so there's not any misuse of the drug. The inherency claim I will be making today is that the Death with Dignity Act should be legalized in all 50 states because the right to die is a human right and is not insured nationwide right now. People across the nation die of extreme pain and without their dignity because their basic human rights are stripped of them. For my first significance claim, terminally ill patients should have the right to autonomy to control their lives. Michigan State University of Law said that the individual right of freedom of autonomy exists in a pre-political state nature, having been granted by one's own creator before or collectively may choose to give away their own freedom of autonomy, but under no circumstances should anyone or government make that decision against their will. For example, patients have the right to refuse medical treatment because they have the right to choose what they want to do with their lives, and no one can take that away. However, the United States has not implemented a law that recognizes the right to physician-assisted death across all 50 states. Going on to my second claim, that people should have the right to die painlessly and in comfort. People with terminally illnesses have the right to refuse medical treatment. However, this causes a drawn-out, painful death. Physician-assisted death is a better alternative to medical treatment. According to Time magazine, Judge Reinhart, who ruled on this issue, said that a competent terminally ill adult having lived nearly the full measure of life has a strong liberty interest in choosing a dignified and humane death rather than being reduced to a childlike state of helplessness, despair, sedated. And when a patient only has a couple months to live, they don't want to lose their dignity. They want to remember how their lives once was and how they were healthy. Brittany Maynard was someone who had brain cancer, and her family came to the conclusion to move to Oregon because at that time they lived in a state that doesn't have legal physician-assisted death. She described that the pill she was going to take is not killing her, but the cancer that she had is killing her, and she'll be in a lot less pain and suffering when she just took the pill to die. Our third significance claim that is that we live in a society that we like to preserve life, but when someone has a strong desire to end their life, it is not a right, and this limits our individual liberty. We, the people of the United States, have fundamental rights no one can take away. According to the Will Justice Project, we have the right to security, the due process of law, and freedom of opinion and expression, freedom of belief and religion, the right to privacy, freedom of assembly and association. We have, and we also have fundamental labor rights. For physician-assisted death, Howard Ball said that there are two main principles in its defense: autonomy, liberty, and the doctor's duty to relieve suffering. He also mentioned the right to self-determination is granted by the liberty provision in the Constitution due process clauses. A terminally ill patient has the liberty to choose death by receiving a fatal prescription from their doctor. However, it's not legal in all states right now, but it's an absolute right processed by the individual from our fundamental rights, and our government can't take that away from us. Ball also mentioned that doctors have a Hippocracy oath, essential message that doctors must do no harm, and it's the primary guideline for doctors. Compassion is not a substitute for appropriate medical treatment of the dying patient until the patient refuses treatment. Furthermore, doctors don't have compassion for their dying patient's individual liberty because they have an oath to do no harm. However, this violates the individual human liberty. The solvency claim rulemaking is that the U.S. should adopt the Death with Dignity Act. According to CNN, as of January 23, 2017, prescriptions have been written for 1,749 people, and 1,127 patients have died from ingesting the drugs that were legally prescribed to them. If the Death with Dignity Act was okay.
Your time is up, so yeah. Hold the cards up